Hi, my name is Sana. I'm going to be your nurse for today. May I know your name and date of birth?
My name is Ahmed, 42386.
Okay, may I know why you're here today?
For physical.
Okay, good. What did you have for lunch yesterday?
Subway.
Alright, good. May I know your job history? What do you do for a living?
I'm a property accountant.
Okay, what did you do 2 years ago?
I was a student at FDU.
Okay, and can I ask you some arithmetic questions? What's 5 plus 5?
10.
Alright, good. I'm going to start with your blood pressure, vitals, and thank you. You were prepared. Okay, good. But can you just lay your arm out straight for me? Good. Your blood pressure is good. It's 180, and I'm going to check your temperature. Can you open your mouth? Can you hold that for me? Great. Oh, 98.2. Excellent. Alright, now I'm going to check for your arms. Temperature looks good. Skin turgor is fair and good. Your skin doesn't look too pale. Now into your capillary refill. Excellent. Now I'm going to palpate for your radial pulse. Good. I'm going to palpate for your brachial pulse. Same on this end. Radial pulse. Brachial pulse. Okay, now we're going to do shoulders, range of motion. Can you move your shoulders forward, backward? Can you touch both of your hands together? Can you move your hands up, down, up? Excellent. Now we're going to do your elbow range of motion. I want you to flex and extend. Flex one more time and extend. Now I'm going to add some resistance. Can you press down on my arms, press up on my arms, and now we're going to do your wrist, range of motion, wiggle your fingers, press down on my arms, no, put your hands straight, press down on my arms, now press up, I want you to pronate and supinate, excellent. Now, I'm going to check your skull, palpate your skull. I want you to lift your eyebrows. Just your eyebrows, not your eyes. I want you to close your eyes as tight as you can. Relax your eyebrows. Close your eyes as tight as you can. Tight as you can. I'm going to add resistance. Excellent. Puff your cheeks. Frown. Clench your teeth. Now I'm going to do your corneal reflex. Open your eye again. Sorry. Okay, good. Okay, good. Now I'm going to check to see if you can sensation. Close your eyes. Tell me if you can feel this.
Yes. 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 Yes.
Excellent. Now we're going to check your eyes. Now I'm going to check for your conjunctiva. Good. I'm going to check for your pupillary reflex. Excellent. Excellent. Now I'm going to shine this light on your nose. Can you look at the light with both eyes? Look at your nose. Look at both eyes. Excellent. Now we're going to do your cardinal field. I want you to look at the pen light. Just look at it with your eyes. Do not move your head. It's called convergence. Now we're going to look at your cardinal fields. I want you to just look at the pen light. Just move your eyes, not your head. Okay, now I need you to stand up. Stand right here. I want you to cover your right eye and read the last bottom rope with your left eye.
D-E-F-P-O-T-E-C.
Alright, go down. Next eye.
D-E-F-P-O-T-E-C.
Excellent. Now I'm going to check your ears. Excellent. Excellent. Now we're going to do two different tests. The first test is called the Weber test. I'm going to place the tuning fork on your head and I want to know if you can hear it on both sides. Can you hear it on both sides?
Yes.
Alright. Now the next test is called Renee test. It tests for air conduction versus bone conduction, okay? Now I'm going to place this on your mastoid bone. Can you tell me when you stop hearing this?
No.
Can you still hear it?
Yes.
Okay, great. Okay, now I'm going to check your mouth. I'm going to check your nose, sorry. Looks pink and moist. I'm going to check your sinuses real quick. Does it hurt?
No.
Does it hurt now?
No.
Okay, I have something in this bowl. I want you to smell it and tell me what it is.
Coffee.
Great. Now, I'm going to check your mouth. Can you say with your tongue out? Good. It looks pink and moist. Excellent. I want you to I'm going to check for your gag reflex. Put your tongue out. Okay. I want you to take your tongue out. Protrude your tongue backward, side to side, up to the rooftop. Okay, great. Now, I'm going to check for your TMJ. I want you to clench your teeth. Move your jaw frontward, backward, side to side. Open your mouth, and close it. Excellent. Now I'm going to check for your thyroid. Can you swallow, please? Swallow again. Swallow. Mm-hmm. Now I'm going to palpate your carotid pulse. Now I'm going to auscultate your carotid pulse. Excellent. Now I'm going to check your lymph nodes. So look down, please. 2, 3, 4. Great. Now I'm going to check your heart sounds. You don't need to breathe in. Now I'm going to check your apical pulse. Now I'm going to assess your respiratory. Can you breathe in and out, deeply and nicely? In and out. Okay. Breathe in. Out. Breathe in. Out. Alright, now I'm going to anteriorly check for your lung sound. Breathe in. Out. 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 In. Great. Moving up your back. In. Out. In. Out. In. Out. In. Out. In. Out. In. Out. Keep doing that, please. Good. Excellent. Now I'm going to percuss your lung sound. Alright, great. Now I want you to lay down. I'm going to check for your abdomen. I'm going to check for any distensions or bulges. I don't see any. I'm going to auscultate your bowel sounds. Now I'm going to palpate. Tell me if it hurts anywhere, okay?
No. No.
Alright, excellent. Now I'm going to check for your legs. I'm going to inspect your legs for any, there's no edema. Skin turgor looks good and fair. Capillary refill. Okay, I'm going to check your pulses. Pulse again. Right, great. Pulse one more time. Very good. Now we're going to do ankle range of motion. Can you rotate your ankle? Wiggle your toes. Can you dorsiflex? Dorsiflex is the other way. Flex. Plantar flex. Okay. Now I'm going to add resistance. Can you forward? Backward? Excellent. Now I'm going to do your knee range of motion. I'm going to bend your knee. Does it hurt?
No.
Bend this knee. Does it hurt? Now we're going to do hip. We're going to rotate it nicely. Okay, good. Put it up. Rotate it nicely. Now we're going to move it out and in. Sorry about that. Move it out and in. Now I'm going to do your defensive reflex. Just to check your reflex. Okay, good. Alright, great. Now I want you to sit up. We're going to do your sensory functions. Now you have to differentiate between sharp and dull. Close your eyes.
Sharp. Dull. Sharp.
This?
Sharp.
This is not sharp, this is dull.
Okay.
Sharp. Okay. Now, I'm going to give you an object in your hand. You have to tell me what it is.
Feels like a coin. A
Okay.
quarter.
Quarter. Great. Now, I'm going to write something on your hand. Tell me what letter or number you think it is.
S.
The letter S. Excellent. Now I'm going to touch anywhere on your hands. Now you have to tell me where I touch.
Left forearm.
Okay, great. I'm going to move your arm. You tell me what direction you're moving it in.
Up. Down. Up. Down.
Alright, great. Now I'm going to do your reflexes. Alright. Now, first we're going to do your biceps. Let go of your arm. Great. Good. Great. Do your patellar. Shin. Alright, great. Now, I'm going to check for your sensation. Alright, I want you to stand up. Face me. Close your eyes. I'm going to check your balance. Move your hand forward. Move your hand forward. I'm going to check for your balance. I want you to walk. I want you to go stand over there. Turn around and walk heel to toe. 1, 2, 3, 4, 5. Good. Now I want you to do heel to shin. Do heel to shin. Excellent. Heel to shin. Excellent. Now I'm going to do the finger to nose test. So I want you to close your eyes. I want you to touch your nose with this finger. 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 Now I want you to bend. I'm going to check for your spine. Bend down, please. Straight. Straight. Alright, move back. Move forward. Move side to side. Do you feel any pain?
No.
Alright, great. It was a pleasure doing this lesson on you today. I hope to see you again soon.
Thank you.
No problem.